Yep.
Fantastic. Well, thanks everybody for joining, and thanks for those that are listening at a later date. My name is Steve Hines. I work with AFLAC and have been working with Sharice and team on the benefits for the city of Pittsburgh. So today I'd just like to run through the product offerings for each of the different products and give a little bit of detail on each of the available plans that are in place today. So the voluntary plan offerings include accident, critical illness, hospital indemnity, short-term disability, whole life, and pet insurance, which is offered through a partner of ours called Trupanion. And I'll go through each of these products in detail as we go. The nice thing about the AFLAC supplemental benefits plans are they're available to you, your spouse, and children. In order to cover your spouse and children, the employee must elect coverage in all benefits, each of the benefits, I shouldn't say all, but there's no pre-existing conditions for the accident, CI, and hospital plans. All of the products are guarantee issues, so there's no medical questions when you choose to enroll in plans. So if you elect coverage, you will be issued coverage as of the first of the year. There's no waiting periods. Plans are portable as well. So if you elect a coverage today and for some reason leave the city of Pittsburgh as an employee, you can take that plan with you. So I'm going to start with the accident plan. And please, if anybody on the line has questions as I go through, just jump in and ask that question. If not, we can take some questions and answers at the end as well. So the accident plan, there's 40 covered services. You're going to see a few of them here. When we talk about accident, people seem to think about auto accidents. So coverage for auto accidents. This is really a plan that's built to help cover treatment for any kind of accidental injury. So you think about a car accident, a slip and fall on the ice, maybe on the way to work, your children swinging on the swing set at the playground at school, fall off and break a bone and need to go to get treatment. All those types of things are covered here. So you can just see the quick list. So broken bones, dislocations, surgeries, just a trip to the ER. And I'll go through a claim example here in a minute to show you a little bit more about how this product works. So there's two plans in place. You can either choose Plan 1 or Plan 2. Plan 1's a good plan, but Plan 2 offers additional benefits or a higher level of benefits for the same covered services. So you can see here things like hospital admission, confinement, follow-up treatment, physical therapy, fractures, dislocations, etc. So these are all things that are covered under the accident plan under both plans. There's also a wellness benefit, and this wellness benefit is available to each insured person. So if an employee elects coverage for their family, then the employee can file a wellness benefit, the spouse can file a wellness benefit, and then any of the dependent children that are on the plan can also file a wellness benefit. And the nice thing is the wellness benefits are the same for multiple plans. So for example, if you had the accident plan and let's say you choose a critical illness plan as well, you could actually file the wellness benefit for both products at the same time. But things that would be an eligible expense for the wellness benefit: physical exams, mammograms, pap smears, blood tests, things like that. So there's actually 33 different wellness screenings that you can get that would apply to that wellness benefit. So how the accident plan works. So I want to go through a claim example. The nice thing about these benefits is they are paid directly to the employee, regardless of any medical bills, regardless of any out-of-pocket expenses. So let's have a scenario. We're coming up on the end of this year. Let's say you had this plan from the beginning of the year, and you've already satisfied your medical plan out-of-pocket expenses. So you go back to the hospital or a doctor. There's going to be zero out-of-pocket expenses. We'll still pay you the full benefit regardless of whether you have any medical bills or not. And that money can be used for whatever you see fit. So in this example, it's an injured leg. person goes to the hospital to get checked out in an ambulance, goes to the ER and is diagnosed with a fracture and leaves the hospital on crutches. So the benefit there would be $3,350. So this assumes that you're on the plan 2, the accident plan 2. But if you look at the fine print below, you'll see, so for a closed reduction leg fracture, that just means there's nothing sticking out of the skin. There's a $2,400 benefit there. The emergency room with treatment, with x-ray is $300. There's 2 follow-up visits at $75 per visit, so $150. The ambulance ride is actually a $400 benefit, and then the appliance, which in this case would be crutches, is $100. So you add all those benefits together, AFLAC is going to send that employee a check for $3,350. So any questions about that accident plan or the benefits there? If not, we'll move on to the next product. All right. So hospital indemnity plan, this is a very simple plan. Hospital indemnity plans pay you if you're hospitalized, I should say admitted to the hospital, and then they also pay you for each day that you're confined in the hospital. So let me move this because I think this might be blocking. So if you look at this page, again, there's 2 options for you, plan 1 and plan 2. They cover the exact same benefits. There's just a higher level of reimbursement on plan 2 than there's in plan 1. But hospital admission, it's paid 1 time a year per covered accident and illness. So if you go in for multiple illnesses, it'll cover you for those, but just 1 time for each. So the hospital admission benefit on plan 1 is $500. On plan 2, it's $1,000. And then you can see the confinement benefit and then the hospital intensive care benefit. So if you're actually admitted to the intensive care, there's a higher level of benefit, and that actually pays in addition to the confinement benefit. So in a scenario where you're taken to the hospital, you're admitted into the ICU, let's say you have plan 1, you'd actually get $200 plus $100 for each day that you're in there. So in the ICU, you would actually get $300. On plan 2, you'd actually get $600 per day for those benefits. Sorry, I've got to work my magic here to get back to the next page. So again, coverage available for you and your spouses and children. And there's no pre-existing condition limitations. So essentially, if you enroll during open enrollment up through October 31st, you're going to be issued coverage January 1st. And if you have a claim on January 1st, you're covered. So no waiting periods, no pregnancy limitations, which is great. So a common use of this plan, obviously, would be maternity. So you're admitted to the hospital for childbirth. You're typically in there for 2 or 3 days. So even if you or your spouse is pregnant today and you elect this coverage, as long as that hospital admission happens on January 1st or after, that would be an eligible expense. So to give you another claim example, you elect the plan 1 option. You have a fever, you go to the emergency room, the physician admits you into the hospital and you spend 3 days there. That benefit would be $800. So it's a $500 admission benefit and then $100 each day that you're in the hospital for 3 days. So in this scenario, $800. So really the key to this plan is that hospital admission. What you'll find today, sometimes employees or people will go into the hospital and they will be brought in just for observation. They're not actually admitted. So if you are in there only for observation, this benefit's not going to pay. It's really for that hospital admission. Any questions about the hospital indemnity plan? All right. So the critical illness plan, I always say the accident plan is kind of for your bumps and bruises. The critical illness plan is for a life-changing diagnosis of a critical illness. So you think about having a diagnosis of a heart attack, cancer, needing an organ transplant, diabetes, those sort of things. This plan is basically there to provide you a benefit upon diagnosis of one of the covered critical illnesses. So if you look at this page, there's a lot of things that are covered. some at 100%, some at 25%. And then there's also coverage for hospitalization on the human coronavirus. But this is going to pay a lump sum benefit based on the diagnosis of one of these critical illnesses. And we'll go through some examples here in a minute. But again, it's a lump sum benefit. Guarantee issue is $30,000. So you can elect up to $30,000 if you're diagnosed with one of the conditions on this previous page. If it's one in that top light blue box, you're going to get 100%. So in a scenario where, let's say you elected $30,000 of coverage, you go into the hospital, you're diagnosed with a heart attack, AFLAC's going to send you a check for $30,000. Again, that's paid directly to the employee, can either be a paper check or direct deposit, and you can use that money for anything that you see fit. Dependent children are covered at half the employee's amount at no charge. So if you elect, let's say $10,000, your children will be covered free of charge at $5,000. There's no benefit reduction at any age. There's no waiting period. And there's no pre-existing condition limitation other than cancer. So if you've been diagnosed with cancer previously, because of the nature and the treatment of cancer diagnosis, there's a 12-month limit. So if you've been treatment-free or cancer-free for 12 months, you'd be covered right away. If you've gone through any treatment in the past 12 months for cancer, there is going to be a limitation. However, if you purchase this product, if you've had cancer or gone through cancer treatment, and let's say after the first of the year you're diagnosed with a heart attack or one of those other conditions, that benefit would still be paid in full. It would just, that pre-existing would only apply to the cancer plan. Again, health screening benefit of, oh, go ahead.
A question. Let's say you were diagnosed with a condition, let's say cancer in October, but you didn't go in to have surgery or any treatment till January. Is it covered?
So it's based on the diagnosis date. So
Okay.
if you're diagnosed in October, it wouldn't be an eligible expense. If you're diagnosed on January 1st or beyond, then it would be covered. Yeah, very good. Yeah, good question. So the health screening benefits very similar to the accident. In fact, it mirrors the accident plan. A $50 wellness benefit for employees, spouses, and dependent children, and it's going to cover all the same tests as they do on the accident plan. The nice thing about the critical illness, there's also some different benefits. So there's a first occurrence benefit, obviously, when you're diagnosed, you're going to get that. There's an additional diagnosis benefit. So if you had a different diagnosis and it's been separated by 6 months, so let's say diagnosed with cancer January 1st of 2024, 6 months later, you're diagnosed with a heart attack, you're going to get the full benefit for both of those diagnoses. So if you had $30,000 of coverage, you would get $30,000 in both scenarios, so a total of $60,000. There's also a reoccurrence benefit. So let's say you had a heart attack January 1st. You're working on getting better. 8 months down the road, you have another heart attack. As long as it's separated by 6 months, we'd pay you another reoccurrence benefit for that same illness. So $30,000 in January. Let's say in August you have another heart attack. We pay you the full $30,000 in August for that reoccurrence of the same benefit. Hopefully that doesn't happen. It sounds a little bit extreme, but it's nice to know there are some additional benefits. So here's an example, just kind of what I was talking about. Cervical cancer diagnosis on 3/1/21. This employee elected a $10,000 benefit. That benefit's paid out. They're remission and treatment free. Over a year later, they're diagnosed with lung cancer the following December of 22. An additional $10,000 benefit would be paid for cancer, even though that full $10,000 was paid once before. So that's how the reoccurrence benefit works on the critical illness. And just to give you an example, similar to what we did for the other two products, CI is elected for $15,000. The employee or spouse experiences chest pains and numbness in the left arm, visit the ER, and a physician diagnoses them with a heart attack. That lump sum, $15,000, is paid out to that employee. And again, regardless of medical bills or expenses. That money is going to be paid directly to the employee and can be used for anything, lost wages, medical care, whatever it might be. So any questions about the critical illness plan? All right. We're going to move on to short-term disability. In par for the course, there are two benefit options for short-term disability. There's two plans. One is a 6-month duration. The other is a 12-month duration. What that means is if you're out of work and you've lost income for up to 6 months, you're going to get a benefit for the short-term disability on plan 1. If you're out of work and unable to earn income for 12 months on plan 2, there's a benefit. So the plans work a little bit differently. The plan 1 is a 0, what we call a 0-7 plan, which means the first day that you're out for an accident, you can start earning a benefit on the short-term disability. The 8th day that you're out for an illness, you'll start receiving a short-term disability benefit. And on plan 2, it's 14 days for both. So what that means is you've got to be out of work for that elimination period before benefits start to be payable. The maximum monthly benefit for both plans is $3,000. And this plan, even though it's guarantee issue, so if you elect coverage, you'll be issued coverage on January 1st. There is a pre-existing condition limitation. So what they're going to say is if you file a claim within the first year, they're going to look back 3 months prior to the effective date and find out, all right, were you diagnosed or receiving treatment for something, some pre-existing disability? If so, you wouldn't be covered for that specific disability for 12 months. An example of how this works, and again, the short-term disability is there to help replace income lost because you can't work. So, and it's non-occupational coverage, so this would be something that would be, an injury off work or an illness would be covered. But there's a 60% of salary benefit reimbursed. So the certificate holder hurts his back. Goes to the doctor. The doctor determines they'll be out of work for a month while they recover. So because, let's say on plan 1, it's a first day benefit, they're out for a month, so they'll receive 60% of their income for that month while they're out, starting on day 1. So any questions about the short-term disability plan?
I do have a question, Steve. For the short-term disability that you're speaking of now, is this different than that plan right there? Than the plan 1 and plan 2 for the 60% versus the 3,000?
It's 60% up to 3,000 per month.
Okay.
Yep.
Thank
So
you.
if 60% of your salary is more than 3,000 a month, you'd be capped at 3,000.
Okay.
Yep.
So you can choose an amount up to 60% of your income with a maximum of 3,000. Okay.
Correct.
Now I understand.
Yep. Good question. Good
Thank
clarification. And if you want to enroll, the way to do that is to reach out to an enrollment counselor this year. They can help determine what your eligible benefit would be. Thanks, Sharice. And we also have the whole life plan. So the whole life plan is just a permanent life insurance plan. There's, again, guarantee issue up to $100,000 for employees. So you can elect up to $100,000 in coverage for yourself and $25,000 for your spouse. There's also coverage available for children as well. There's a waiver of premium. So if you're disabled and you can't work for up to 4 or beyond 4 months, AFLAC will actually waive premium requirements. So if you're disabled and you're out, let's say for 18 months without being able to work, we'll waive that premium payment for the whole life. So you don't actually have to pay your premiums on the whole life while you're disabled after 4 months. There's an accidental death rider. So if you're unfortunately killed in an accident, benefits would be double. So if you elected $50,000 in coverage in life insurance, you die in an accidental death, your beneficiary would actually receive 2 times the amount, or in that scenario, $100,000. And there's an accelerated death benefit rider as well. So if you are given a certain amount of time expected life to live. Your doctor says, you've got 6 months to live. You can actually get up to 50% of that face value up front. So if you had $50,000 in benefits, the accelerated death benefit would allow you to pull some of that face value to use for medical care, things like that ahead of time. Any questions about the whole life?
Yeah, a couple questions.
Sure.
Whole life, is it permanent?
Yes, it is.
Okay. After age 70, do I maintain it?
You can.
Or can I
Yep.
maintain it?
You can. It's only issued up to age 70. So after age 70, we won't issue a new policy, but yes, you can maintain that policy.
And the premium will increase or stay the same?
Stay the same. So it's an issue age
Right.
policy. So once you buy the whole life, it'll stay that rate throughout the remainder of the policy.
Very good. Thank you.
Absolutely. Any other questions about the whole life? All right. Last but not least, we've got pet insurance. So pet insurance is offered through a partner of ours called Trupanion. And it is available in 3 different plan options through, oops, I'm sorry about that, through Trupanion. So there's an unlimited accident and illness plan. You can see all the things that it covers under the unlimited. There's a basic accident and illness plan, which is a little bit scaled down from the unlimited. And then there's an accident only. So this plan will cover cats and dogs. I believe it'll cover pets up to age 14, or you can get a policy up till age 14. And each policy is going to be specific to that employee's pet. So when you go onto the Trupanion site to look at these 3 plans, it's going to ask you some information about your pet. Is it a cat or dog? What's the breed? How old? Etc. And then it's going to provide a specific quote for your individual animal. So it's a great plan. We have been rolling this out to more and more of our clients. Seems like there's a big interest in pet insurance. So if you have a pet, if you're concerned about either illness or accident, I would encourage you to take a look at these three options as they're pretty good. Again, they're going to be specific to each individual pet. Any questions on the pet insurance? All right. Oops. So last but not least, I'm going to just talk through the customer service and claims. If you enroll on the City of Pittsburgh plans during open enrollment up through the 31st, prior to January 1st, you'll actually receive a welcome packet in the mail that's going to have information that will help guide you toward either AFLAC customer service or to file claims. So there's a few different ways to do it, but our website, aflacgroupinsurance.com, has actual claim forms. So there's PDF claim forms that you can download and print, or you can file claims online as well. So there's multiple ways to do that, but aflacgroupinsurance.com is the website to access claim information. And then there's a customer service number if you have challenges with that. There's also a chat feature on the website. So if you want to chat with a customer service person online, you just simply click the chat button and someone will be there to help you. But in your welcome packet, you will receive this kind of information as well as your certificate number for the products that you enroll in. And then we also have a mobile app, so you can actually file claims on your phone. So it makes it kind of easy to upload, any claim documentation you may need, things like that. As I mentioned, the wellness benefit alignment. So our CI, hospital indemnity, accident plans, we use the same 33 wellness screenings for all of our wellness benefits. So you go in for a routine exam, you can file that wellness benefit for all 3 plans. So pretty nice, easy way to look at it. We used to have different categories for each different plan, but we've streamlined those to include all 33 for all plans. And then cross-plan adjudication. So the nice thing is if you have multiple plans with AFLAC and you file a claim, let's say for accident, and you also have short-term disability and you've missed work, we're going to look at what other benefits you have. So you file the accident claim. We're going to take a look at, are there any other products that perhaps you could file a claim for that you'd also be eligible for? So more than just looking at the specific claim you filed, we're looking at all the products you have in force, and then we'll reach out to you and say, hey, you may be able to file a claim for additional benefits under the plans. So that is my presentation in a nutshell. I just saw that we had a 5-minute warning coming up. So wanted to open it up for any additional questions, discussion.
Steve, it's me again with all the questions. How do we get enrolled in Plan 2 for the short-term disability? I don't think I knew that there was a 1 and a 2, and I have one of them, but I don't know if I had 1 or 2. So
okay, so that would be through the enrollment team with Willis Towers Watson, and I can put that you probably have that phone number, but it's that 855-907.
907.
Yep, 907-3362 number.
Do I need to let them know I'm interested in Plan 2, I guess? Because I'm not sure if I have 1 or 2.
Yeah, I would call them and they can verify what plan you have. And then if you have one and would like to enroll in the other, they can help you do that.
Okay, I'm very interested.
Okay.
I have it, but I don't know if I have 1 or 2. But I got to make sure I have 2.
This is a good time to review.
It is. Well, so, thank you.
Yep, I'm sure you have the documentation, but while I'm on here, I'm just going to add that number into the chat box if anybody else is interested. But that's the number during open enrollment to call an enrollment counselor, and they can help walk you through all the different options, help you look at rates, etc. And then if you want to enroll, they can get you enrolled as well.
Awesome. Thank you, Steve. If nobody has any questions, I will end the meeting. And again, as I mentioned earlier, you will get wellness points for participating.
Thank you, Cherise, and I'll talk to you next week.
Thank you, Steve. See you later.
Take care.
Thanks. Bye-bye.
Bye-bye.
Thank you, Steve.